So people need to know that multiple myeloma is a blood cancer, and about 36,000 new cases will be identified in the United States. And more importantly, over 150,000 patients are living with and/or being treated for the myeloma. It is a disease that arises in the bone marrow when your normal plasma cells become mutated. They then sort of go rogue and avoid normal patterns of growth and differentiation. As a result, they can crowd out normal things in the bone marrow, such as red blood cells resulting in anemia. They can secrete proteins that will cause kidney injury, and they can also destroy bones, making patients at a greater risk for a fracture.
Hey everyone, this is Jonathan Marx from GoToHealth. How are you today? I hope you're having a great day. We have a show on a tough topic today, multiple myeloma. Multiple myeloma is an aggressive blood cancer that is generally considered treatable, but there is no cure. As the second most common blood cancer in the United States, the incidence of multiple myeloma is on the rise, with more than 36,000 new cases estimated to be diagnosed this year. Because the disease often becomes resistant to treatment, continued research and new options remain essential. One of our guests, Dave, broke his leg several years ago, and he never expected it would lead to a diagnosis of multiple myeloma, which is again a rare blood cancer that forms in the bone marrow. After trying several treatment regimens that eventually stopped working, Dave is speaking out today about the complexities of living with multiple myeloma and advocating for others to learn more. Joining Dave today is Dr. Robert Rifkin, MD. He's a hematologist-oncologist at the UC Health System in Steamboat Springs, Colorado. Before we get to our guests, a reminder and a request. If you like our show, please give us a thumbs up or a 5-star review on Apple, Spotify, or YouTube, or wherever you're listening to us. It really helps us get the word out to more people. Thanks in advance. So welcome to the show, Dr. Robert Rifkin and Dave. How are you both today?
We're doing great, and we're delighted to be here on behalf of GSK.
And my name is Dave, and I'm a patient, and I'm very happy to be here as well.
Good. Glad to have you both. So let me start with Dr. Rifkin. What is multiple myeloma? What do people need to know about that?
So people need to know that multiple myeloma is a blood cancer, and about 36,000 new cases will be identified in the United States. And more importantly, over 150,000 patients are living with and/or being treated for the myeloma. It is a disease that arises in the bone marrow when your normal plasma cells become mutated. They then sort of go rogue and avoid normal patterns of growth and differentiation. As a result, they can crowd out normal things in the bone marrow, such as red blood cells resulting in anemia. They can secrete proteins that will cause kidney injury, and they can also destroy bones, making patients at a greater risk for a fracture.
Wow. So let me ask a couple of questions about this. What are the symptoms of multiple myeloma? What should patients be looking for, or when they should first get diagnosed?
So I think, first of all, patients should continue to get their annual history and physical with their health provider. Oftentimes, a regular blood count, a CBC, or a chemistry profile will reveal things that will lead you to go do a diagnostic workup for multiple myeloma. And I think most importantly, if a patient has a persistent complaint, such as back pain that they can't explain or an unexplained anemia, that you keep working until you find the cause of the problem.
Got it. And let me ask, do we know about who gets multiple myeloma? Are there differences between male and female, or ethnicity or race?
It is probably more common in males. Ethnicity and race have received a lot of press recently because it tends to be more common in African Americans and can be more aggressive than in Caucasians. So that has received a lot of attention recently.
Thanks for letting us know that. Dave, let me ask you a couple of questions. Tell us about your journey with multiple myeloma. How did you get first diagnosed? When did you notice this? And tell us about your journey.
Well, it all began with a routine visit to my primary care provider for my annual physical. And during that visit, blood was drawn. And the next day they called me and told me I was very anemic. And my doctor set up an appointment with an oncologist who was at a Boston area cancer facility, which is close to where I live.
Mhm.
And I went in very quickly to see the oncologist, and they drew blood. And the next day, while I was waiting for those results, I was leaving work one evening, and I stopped in the men's room, and I slipped and fell, and I broke my femur, and I did damage to my hip.
Oh,
And so now I was lying in a hospital bed waiting for surgery. And while I was lying in the bed, I was informed that I had something called multiple myeloma, and I had no idea what it was. I had never heard of it. And so at that point, the surgery went on, and I was released 2 days later, and I found myself back in the oncologist's office. He informed me that I had a very aggressive form of the disease, and my initial treatment began that same afternoon. And so this all unfolded over about a 5 or 6 day period.
wow. That must have been so frightening.
It was extremely frightening, where when I first heard that I had the disease, because I didn't know what it was, I had the attitude like anything in my life. You break a bone, let's fix it.
Yeah.
You get sick, let's take some pills and fix it. And this
Yep.
was not the case.
Wow. How old were you when this first came on, Dave?
I was 62.
Okay.
I'm 69 right now, and so I've been, on this journey for a little over 7 years. I was diagnosed at the end of December 2018. So my Christmas and New Year's was being diagnosed and lying in a hospital bed waiting surgery.
Yes. And what kind of treatment have you gotten for this, Dave?
Well, I've undergone a series of treatments over the years that have allowed me to go into remission several times. Unfortunately, my experience has always had me relapse. And every time I've gone through a relapse, I would say it's disappointing, it's disheartening, and I think the biggest thing is it's very, very scary, because what that means is the treatment plan that I was on at the time stopped working. And I have to then very quickly, along with my care team, find a new treatment plan that'll work for me. And as I've gone through this and navigated this disease over 7 years now, I think some things have changed from the initial expectations that my wife and I had, where when I was first diagnosed, we really thought that everything we love to do, we'd never be able to do again. And that hasn't been the case over the years. And as an example, we like to travel. And a few years ago, we were able to travel out of state to my middle son's wedding. This past fall, we went on a cooking and eating tour in parts of Italy.
Good for you.
And at the end of last year, we also went to an island on a vacation with our 3 adult boys and our daughter-in-law, and we're also dog lovers. So we have been able to do all these things while we've navigated the disappointments, the relapses, the startment of new treatment, and our lives have maintained a very high level of normalcy throughout all of this.
Thank God. So, doctor, let me ask you, Dave has gone through multiple relapses with multiple myeloma. I guess that's why it's called multiple. But are there new treatments that are coming out that can help people like Dave?
So this is an exciting time in the myeloma treatment area. We have a number of new treatments. The one I'd like to focus on is one called Blenrep, which is the most recent FDA approval. When given in combination with bortezomib and dexamethasone, the FDA approved this to treat patients such as Dave with multiple myeloma that has relapsed or didn't respond to 2 or more prior treatments. As with any medication, it's important to talk to your healthcare team about your other medical conditions and any side effects you're having. Blenrep can cause serious side effects, including eye problems, resulting in decreased vision. These can be common and quite severe, but importantly, those taking Blenrep will need to see an eye care professional before each dose. Blenrep is very, very active and produces deep and durable remissions.
That's great news, but the side effects sound pretty serious. How does a doctor and a patient balance the medication versus the side effects?
Well, I think the most important part is education, not only on behalf of the patient and the healthcare team, but really getting the optometrist or the ophthalmologist on board to be comfortable with what you see. It's very predictable and can be managed. But you're right, all of our treatments do have significant side effects, and this one's a little bit unique to Blenrep, but easily manageable if you do all of the things that we discussed.
Great. And as a patient, if you think something's going wrong, I guess you just go first see your primary doctor, and you're hoping that your primary doctor will refer you to a specialist when necessary?
Well, I guess I would take a little bit the opposite approach, that if you know you already have a diagnosis of multiple myeloma and you're experiencing someone, you should probably contact your oncologist directly, because they'll be much more familiar than your primary care provider with the medications and treatment plan that you're receiving.
Got it. Dave, how are you doing these days? Where are you in your journey?
Well, I'm very happy to say that in remission, and this has been ongoing now for over 4 years. And my wife and I, my family, our friends, were able to do things together. And as my wife put it, we're building memories, because we're doing a lot of things, as I mentioned before, that we never thought we'd be able to continue doing. And I don't want to say I couldn't be happier. That's not true. I'd be happier if I never had the disease.
Sure.
But we're living life to the fullest, and we're doing as much as we can.
Good. I'm glad to hear that. God bless. So let me ask you both, is there a question I haven't asked that I should have asked, or is there a message you'd like to leave with people today? And I'll take each of you in turn. Dave, why don't you go first?
What I'd like to make sure everybody knows is that if you're diagnosed newly with multiple myeloma or you're in relapse, it's very important that you seek out and meet with a healthcare provider or team that you trust, and you can discuss what treatment options there may be that are available and appropriate for you as an individual. And you should do it without any delay at all. And on top of that, you should never give up hope, because as Dr. Rifkin has mentioned, there are so many advances and discoveries being made in this field. You never know what's coming right around the corner that could work for you.
Good. Thank you. Doctor, what kind of last word would you like to leave us with today?
So I think my last word would be one of hope. The new Blenrep that we discussed briefly can be given in a community setting. There's many, many options for treatment. And so what I tell my patients is education is empowerment. And for this disease, you can go to the Multiple Myeloma Research Foundation or the International Myeloma Foundation website. They have tremendous patient-facing educational materials that are updated regularly, so you can also learn about new treatments very quickly. And as Dave pointed out, do things promptly, don't delay, and ignore things.
Got it. Thank you both for being with us today. This is an important topic, and it's really, I guess the message is, be in touch with your doctor, get regular checkups, and if you feel something's going wrong, get it checked out. We've been talking with Dr. Robert Rifkin, MD. He's a hematologist-oncologist at UC Health System in Steamboat Springs, Colorado, and also Dave, who is a husband and father to 3 grown sons. He retired after working in the tech industry for many years. He was diagnosed with multiple myeloma in 2018, but as you can see, he's living as full a life as possible. Thank you both, gentlemen, for being with us today. It's been great to have you.
Thank you for having us.
Yeah, thank you.
Good. This has been Jonathan Marx with GoToHealth. And as we say at the end of every show, go to health. Take care. We'll see you again next time. Bye-bye. Thanks, guys. That was great.
Thank you, Jonathan.
Thank you.
Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marx in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, Browse through the online store and view our library of over 150 shows at GoToHealthMedia.com. See you next time, and remember to elevate your life with GoToHealth.